Okay, I think we're live and we're live on TikTok. Hi, TikTok. It's Parham, Nematola, and myself, Dr. B. Today we are again Monday morning, 11:30 a.m. We'll be on for an hour and 10 minutes today, and topic that we're gonna digest here and throw around is types of benzodiazepines. I think it was asked, and Parham's on. So go to YouTube channel, Dr. B Addiction Recovery. We're live. You can either post your questions, Parham pulls them off the live chat, or you can come on and talk to us directly. Hi, Parham. How are you?
What's up,
Hi.
Dr. B? I'm doing good. What's up, everyone? We got
Hi, guys.
Nicole, Madi, the goddess diva, Sandy. Got a bunch of people on right now. Darlene, welcome, everyone. And we look forward to another live stream with you, to answering your questions, giving real-time updates. What's up, Julie? And all that kind of stuff. So whenever you do post questions or you want to hop on the video to talk to us, I will always do my best to post your questions. It looks like we already have someone getting ready to come close. So we're and today we are talking about the different types of benzodiazepines. As you guys know, Dr. B being the medical professional and the physician, he's going to be talking a little bit more on that side. And I'll gladly come talk about some of the psychosocial ramifications of getting off benzodiazepines, or the withdrawal process or the detox process, how it manifests at the level of the mind and the body of a human being. So that's kind of what I have there. And Dr. B, feel free to start us off, my man. I'll sit back and gladly listen.
Um, sure. How do we start this? Let's see. So benzodiazepines um, first discovered in the 50s, I think late 50s. And the first one was an intermediate acting one. I can never pronounce it. Chlorodiazepoxide was the first one. Chlorodiazepoxide was the first one, 1957. It was sort of discovered by accident. What was the issue, and what was, and this will all, the historical picture will give some insight into why it's important. What was the issue, and why were they looking for a new medication for sedation? And the reason was the one that was big before that was barbiturates. Okay, and everyone knows barbiturates, and they were really they're a great medication. They were discovered in the 20s, I believe. And the problem with barbiturates is they have what's called a narrow therapeutic index. Okay, the safety margin and the toxicity margin is a narrow line. Okay, that was an issue. There was a lot of abuse, and there were thousands of overdoses, probably more than we think of. You know, a famous one is Marilyn Monroe, right? I think isn't that what she overdosed on? And oftentimes they mixed the barbiturate with another sedative hypnotic, and a popular one is alcohol. And when you do that, you have a synergistic effect of respiratory depression and sedation. So most of those overdoses were often with something else as powerful as barbiturates were. Um, Before that, what did we use? We used chloral hydrate, which we still use. I used to use it on children. We used bromide, and opium was a sedative of choice for years and years and years and years and years. Okay, and so this first one came out in 1967. I think Valium followed soon, and by the 70s, this stuff was really marketed heavily across the world and in the U.S. As the safe. The way marketing goes is that you no longer have a problem of dependence and overdose. Not true. Okay. As a general class, they're used as a general class within the pharmacological sedative hypnotic class. They're used for much more than an anxiolytic issue. These are used, and depending whether you use some IV form or otherwise, These are for seizures. They're great for seizures. Okay, great seizure medication. And remember, most of these work on the GABA receptor. Okay, almost all of them work on the GABA receptor, and GABA receptor is quite complex. It has five subdomains, and this gets a little bit complex, but it's not just it goes to the GABA receptor. It's much more complex, and there's different kinds of GABA receptors. But in general, benzodiazepines as a class are used for seizures, psychomotor agitation, withdrawal from alcohols, and there's a reason you use this for withdrawal from alcohols. Um, we use it for an amnesia. Well, before you go into the OR for big things, not that only does it sedate, it's an amnestic, right? You don't just in case, they push that Versed, they don't want you to remember them cutting your belly open and sitting there cracking jokes, right? So they're used for that as well. They are used for things like intubation, okay? And what muscle relaxation when you have things like serotonin toxicity, uh, neuroleptic malignant syndrome, for those of you that might know what that is. And another area that these are used for is a lot of envenomations, a lot of poisoning overdoses. The antidote is a benzo, which is very interesting. And so then we come up all the way to the 90s, right? And we sort of realized that these have a potential for abuse. There is a lot of under the radar abuse and addiction. And to this day, I've always said this is a silent epidemic. In addition, continued use with alcohol somewhat recognized, and all of a sudden in the 90s you come up with some of the sleep medications that everyone knows about, right? The Ambien, the Zolpidem, all that stuff. Again, sort of marketed as the safer alternative. We call those the Z drugs. Slightly different structure, slightly different mechanism, same deal. Put you to sleep. Turns out those also have an abuse potential, but much smaller than the usual benzodiazepines. And here we are. Here we are today. And one of the things that we can say about them is that they are really meant for short term use. And for so many years, and even to this day, people were put on them for chronic long term use. Yeah, very few select cases that a doctor should put somebody. See, nowadays I'll put someone on long term use, but that reality has already been created, and there's thousands of people with the issue. So you have a different animal to deal with, but they were intended for short term on and off. And if those people that will need longer term use, they should have been very closely observed. What is the differences between the benzodiazepines? Only difference is short acting, long acting, and one other phenomena that's a big deal that people are often confused with the short acting feature or a component of it is the fact that how quickly does it cross the blood brain barrier? And if I can give an analogy, this is like smoking crack gets across to your central nervous system much quicker than if you were doing lines of cocaine, right? And so what that does theoretically, is it creates a much, much, much higher abuse potential and addiction. And analogy I like to use is imagine Parham eating, drinking a soda every morning, right? Which is a very simple sugar, and that destroys your receptors, and you get metabolic syndromes, mainly diabetes, versus having a complex carbohydrate. Slamming those receptors quickly, you run into problems. You could see it with sugars, and you could see it with benzodiazepines or any other drug. It creates rapid addiction, Xanax being one of them. And that's why there's always a move to do a cross tolerance, which means equivalent dose to a longer acting benzodiazepine, and then start weaning somebody off. And that's pretty much my basic introduction to benzodiazepines.
Right on, man. Well, that was beyond basic, Dr. B. That was, thank you for going through the history. I always appreciate that. I actually learn a little bit about it every time you go through the various histories. And for me, as a mental health professional, for those of you who don't know, I got a master's degree in marriage and family therapy. I'm a licensed addictions counselor in my space. So I'm not talking about just people that are not going through rehabilitation for their substance use. And that's kind of the population I'm talking about. In my space, I'm always curious to know when the onset of use started with something like a benzodiazepine. And what it looks like oftentimes is like this, that there was some type of a situational or some type of a life event in the individual's life that was causing them to experience anxiety in their world, right? The various little triggers, little factors, something like a separation of a family member, something like a relocation to a new place, something like a sudden loss, of old lifestyles that sets them up to experience a lot of anxiety. And a lot of times if people don't know how to manage that anxiety with coping skills, they'll go see a therapist. The therapist might send them to a psychiatrist, and they find the temporary solution to be able to support that, the excessive anxiety. And it comes in the form of, let's call it like a Xanax or something like that. And what happens is it works for people, right? It absolutely works. And it takes away the anxiety. And if they're having insomnia at night, various types of benzodiazepines might even help them go to sleep at night. If they're going through social anxieties, certain type of OCDs, there's some things that it helps with. However, I've been on record saying this all the time, and I've said it to every single caller we've ever had. Medications, the right medications is wonderful. Therapy along with medications is always ideal, because the goal of the therapeutic process is to get to the root cause of when and where the symptomology and the discomfort started, to be able to start processing and working through and resolving that. Because if you don't get to the root of your anxiety, my friends, there's not an amount of pills or a type of pill or anything that's actually going to help long term. And that's kind of the thing that I talk about here every single time is, have you gotten to the root of your anxiety? I mean, I've worked with so many young adults, Dr. B, that, for example, when they were 12, 13 years old, their parents went through a nasty divorce. And right after it, they start to experience significant amount of anxiety, panic attacks. And they go to the doctor, and the doctor's like, hey, you're experiencing anxiety. This medication is what I would recommend. Not knowing that they take that medication and they do okay in life. But then, 10 years down the line, 15 years down the line, they have this significant amount of anxiety that the medication isn't helping for anymore. Either they start using more, or they, change substances, but they never get to the root cause of what life felt like at 12 or 13 years old, when you felt like you were abandoned, or you felt like your parents didn't care about you, or you felt like you're going to be alone in this world, or you felt like you have to create a new identity, or you would hear mom and dad yelling and screaming about each other and going to the courtrooms and all that kind of stuff, the impact that can have on the nervous system of a child. They never process that through. So that's kind of what's really important there for me, to be able to highlight when the callers call in. And we have a couple of people, I think, that are already in the queue, that you can talk about your medication and talk to Dr. B about, the various medications you've been on, this and that. But I will ask you, what else have you been doing outside of the medication regimen for dealing with your anxiety? Because if that's it, unfortunately, you're going to fall short one day, and that's a professional opinion.
I'll get we'll get you guys up in 1 second. I just want to add to Parham. I've noticed that with benzodiazepines, what Parham is saying is even more important than opiates. And here's what I've observed happening. I think the literature, for the most part, supports this. And there's trauma of different sorts, different types, and we can really get into this. And what I notice is that coping mechanisms that somebody may have, their physiology just runs out of gas by their 30s, or a major event like Parham said happens, where the whole thing blows up. At that point, they develop a hypersensitivity to psychotropics, in addition to the fact that everything has kind of fell apart now. And this is a huge, huge issue. And when the drug that is the issue here mixed in with all this is a benzo, these protracted long-term withdrawals are a nightmare, and it becomes a huge animal. And I see it in so many different ways. You'll see people using opiates in the same way, but with the benzos, it's particularly problematic. And so
There's
that
something. I thank you, doctor, for saying that because I know you. That's your professional. That's what you've witnessed. Working with people that you've seen it be more problematic with the benzos. But there's a comment here. I just want to touch on this. According to Heather, I had my first panic attack at 7 years old, going to the movie theater for the first time. I didn't know what was happening at the time. I swear it seems I was born with anxiety and panic. So obviously, Heather, I don't know you and I don't know anything about your history, but this very last sentence that you wrote there, I swear it seems I was born with anxiety and panic. There actually are children that are born with anxiety and panic. And I'll tell you why. Because lifespan development doesn't start the moment you're born. Lifespan development starts the moment the mom is pregnant with the child, right? So there's a lot of people that I've worked with, and I'm not saying this is your case, Heather. I just want to use this as an educational piece. There's a lot of people who their moms were stressed during pregnancy. They experienced a lot of stress. They experienced just whatever life was happening to them, and they downloaded that stress into the child. And the child, when it was born, actually had a higher baseline of anxiety. And this happens in our culture. I mean, me and Dr. B, we come from the country of Iran. From 1980 to 1988, there was a war between Iran and Iraq. And there's a lot of babies, one of them is this person talking in the camera right now, that when my mom was born, they would constantly have to hear sirens like we hear in Ukraine right now for air attacks. And they would have to go into the basements of their home for shelter and safety because the city was about to get bombed. Now, what do you think happens to that anxiety of my mom onto me? So when I was born, I was an anxious little child. Long before I knew what emotional distress from like life triggers were, I was always anxious. This happened in World War II, by the way, with a lot of the Jewish babies. They were experiencing night tremors and crying all night long and all that kind of stuff like that because they were just downloading what was happening. And that's probably what's happening right now in Ukraine with all the children there and stuff like that. Long before they ever pick up a drink or a drug, they're going to have a more of an anxious disposition to life because of the stress and the collective worry that they're experiencing right now. So I want everyone to know that it's not always what happens to you in life, 12, 13, 14 years old. Sometimes it's before you have conscious memory. Sometimes it's when you're in the womb. How about that? So I believe it.
and to add to that, Parham, and we'll get to Heather. There's also you may what or there may be some. So that's one thing. And from the age of 1 to 7, you just simply may not remember what occurred, and it's really in your subconscious at this time. Nevertheless, it's there, and it's part of your ego construct, and it is driving the ship here, causing this sort of anxiety. Keep that in mind. TikTok, if you guys just joined, please go YouTube Addiction Recovery. Me and Parham are live on there. And Parham, should we bring some of
Yeah,
these?
let me hide this comment. And someone just wrote right before we bring Goddess Diva, we're bringing in 1 minute. Right here, Amanda wrote, I had a therapist ask me if my mother had a traumatic birth or pregnancy, as seems like I've had anxiety since I can remember. So yes, this is very true. Yeah, a good therapist is always going to look at when they do a full assessment, they don't start from the day you were born. They actually start from about 9 months to a year before that to see what was going on around the home, because all that's going to have a significant impact on the development of the child that's coming out. So the Goddess Diva, we're going to bring you in. Can you hear us?
Yes, can you hear me?
Yes, we can hear you.
Hello.
Hi.
Oh my gosh, I can't believe I'm on here. I'm trying to write my questions down. I don't know how to do the camera thing. I have a fortune cookie of a fortune on my camera, so I don't know how to operate that. Hello to my home state where I was born and raised, and I left in 1978. I miss my beautiful California. I hate these hurricanes. They freak me out. I have PTSD from the hurricanes, but I have childhood PTSD from abuse from the mother. So even to this day, I'm an old lady and I still get the abuse. So there is no talking of that for that. Anyways, I was taking X for 15 years 12 to 15 years. 1 milligram up to 3 times a day. I would take half the time.
When you say X, you're referring to a Xanax, correct?
Yeah, alprazolam. I can't afford the actual.
That's okay. Yeah, no, X. I just want to make sure that we're talking about the same.
Yeah,
thing.
And it wasn't until I joined one of those groups that, because you have to abbreviate everything off of Facebook. Anyways, so that's why I put X. Is that? I'm sorry.
You're okay.
Go for it. Yeah, that's okay. Go for it.
Well, anyways, thank you for talking to me. I really have millions of questions, but anyways, I was on fluoxetine, 20 milligrams once a day. My original doctor tried to put me on 40 and then 60, but I guess now what they call it, tardive dyskinesia, my right side of my mouth would quiver, so I went down to 20, and then I got to where I was only taking like 3 a week and then 2 a week. A pharmacist told me because I had such a large amount of alprazolam that I was able to mask the side effects, the increased anxiety caused from the fluoxetine. So I really wasn't taking it regular. And I was tried on Lexapro and Zoloft and others as well, and could not take them. They made me sick. So the new doctor told me, oh yeah, after a couple of weeks, you'll on trazodone, and just keep going up on the trazodone and take your fluoxetine. And after my 3rd visit, he pegged me for high blood pressure, which they can do that, but I have white coat syndrome and I'm paranoid of this new doctor as it is. So he gave me all these blood pressure medicines, and so they all made me so sick. I just stopped the 4th one, which the anxiety never went away, and nightmares and everything caused from it. And as far as activation syndrome and deactivation syndrome off the fluoxetine, so I'm off of everything, including the lisinopril, and just on the alprazolam, down to 1 milligrams now since May. Initially only gave me 15. Luckily I found some hurricane stashes throughout the house to get me through until he finally started giving me 35. Now I've been tapering to where I have a little piece left. I've just been cutting little pieces throughout the day. And out of that 35, I have 4.5 tablets left of last month. And I just got a refill. I had to go in for a urine test in January. I don't have insurance. And so, any new doctors I tried, they just say go to a psychiatrist, and it's just not feasible for me. I'm sorry, Parham. I'll shut up.
No, that's okay. I have a hard time standing still. Keep going.
Okay, no. I just don't know what else to say.
So, I'm sorry. What was the highest dose you were on ever on the Xanax?
Just the 1 mil. It's 90 tablets a month, but actually I would usually take like 5 to 10 out of the prescription, sometimes even more, and put it up. So I would have like, I don't talk like that, but I can if you want me to. Anyways, I would have like 10 put up for hurricane emergency. So I'd have like a little stash. Do you know what I'm saying? So that I wouldn't freak out if a hurricane occurred. My previous doctor was accused of sexually abusing one of his patients, which I've been going to him for 30 years, and he was never abusive to me in any way or inappropriate. And I was kind of cute back then.
And are you trying to taper to 0, or are you just...
Well, I don't know. I mean, I have no communication with this doctor. I mean, he just sits there on his laptop. And look, and unfortunately, I found him on Facebook there's a page called The Good, the Bad, and the Ugly of Southeast Texas. And all these people say the good, the bad about, businesses, the roofers, etc. And his name popped up, and everybody said the same thing. So I thought I was crazy. I mean, he's like, the man doesn't look at me. He's never examined me. He's never touched me. And everybody said the same thing and worse things than that. I won't go there. But anyways, I just want to know, with this process, if I can take a little bit of chamomile tea, with the honey because I'm trying to get off the sugar and trying to eat properly. I eat, baby kale and baby spinach every day and do everything I'm supposed to. But the magnesium glycinate seems to be helping me. I was taking up to 800 milligrams a day in 100 milligram increments, but it was suggested to me at a group that I'm in not to do that. So I don't know. that it interferes with healing the brain, etc., the benzo brain, so to speak.
Yeah. So I'm going to turn it over to Parham, but what I will say is this. Remember, I said earlier, this is
I'm
not.
really nervous, Doc. I'm sorry.
No, don't be nervous. I'll give you a general thoughts, not medical advice, but my general thoughts. If someone like you, with the limited information I have, is this: we're not where we should be, which is the initiation of the benzos. So we're at a different reality. At this point right now, it appears that you're stabilizing on this dose for now. Don't be in such a rush to get off. I don't even know if you have benzo brain. More importantly, do all of those things, including good mental health, engagement, to heal yourself generally from the ground up. The benzos is what it is, and it's where it's at right now. You would do yourself a lot better if the situation calls for you stabilizing and staying on this dose. And let me tell you something else. I hear all the time.
I fear he's going to cut me off, Doc, though. I don't know. There's no communication whatsoever, actually.
Then I would have an open discussion with him. It's the only thing you can do at first. At first, that's the only thing you can really do. Get a sense of where you're at. And if he says, I'm cutting you off, get a timeline. And so move forward with information. Let me add one more thing. A lot of times I hear people talking about benzo brain and so forth. I'm going to say this. The people, I don't know if they realize this, but anxiety, depression, dysphoria, neuroticism, these are very complex psychological dispositions. They cause memory loss. They cause drops in IQ. So the quicker somebody, and all sorts of cognitive issues and fine motor skills issues. So the sooner someone really engages in mental health therapy and good eating and drinking water and a better lifestyle, it will facilitate whatever you want to do with medication. That's the general advice I have to give. I'll turn it over to Parham. I'm sure he has quite a bit to say on this.
Yeah,
Parham, I'm watching a licensed therapist, her on YouTube.
Awesome.
Her channel's called Therapy in a Nutshell. So I follow a lot of her anxiety techniques and tapping into the vagus nerve. And then I do 2 other vagus nerve techniques. I try to pray and meditate and do walks throughout the day because I actually can function. I'm not in the bed anymore. So, but I do try to do what you mentioned, Parham, and Dr. B. I try to do whatever I can naturally. And I watch a psychiatrist online on YouTube. Her name is Dr. Tracy March. She's awesome. But again, I just, this happened and then overnight I've been in total heck. So it's just really, really horrifying. And this is the first time I'm actually able to be like a real human and talk to you because I'm literally going through withdrawal still. And I had no idea.
Yeah, well, I want you to know that you're actually doing a wonderful job. Not only speaking about your history, but you sound coherent. You sound very engaged in your life. You sound like you are doing positive things to supplement the support that medications can bring. A couple things that stood out to me on your private chat. And I just want to clear up too. Some people think the dose was higher that you're saying you're taking. It's not 30 milligrams a day she's taking. It's 90 pills for the month, and they're 1 milligram each. And
correct.
She can take up to 3 of them a day. So I just want to clear that up. Some people said, man, 30 milligrams a day, that's too much.
Oh my God. No. And I would only take I only would take half at a time if as needed. I mean, whenever things got really hairy for me, especially during hurricanes, Rita, Ike, Harvey. Oh my God. By myself. My husband was a trucker and now he's retired. So we have no insurance.
The part that stood out to me in your private chat was you said 15 years ago you got on the Xanax. And
12 to 15 around that. Yeah.
Yeah. So that's the first number that I wonder. I'm curious to know when you get into the kind of, whether you're figuring it out on yourself by watching therapists and journaling and writing or talking to people and hopefully maybe talking to a therapist about specifically you. What happened 12 to 15 years ago that triggered you to have the need for medication support to cope with your anxiety, because you also said that you had PTSD and childhood PTSD. So my guess is that all of that stuff that you were bottling up for so freaking long, and that's a long history to bottle that stuff up, 12 to 15 years ago, it just got to a point that it became too much for you to handle. And that's when like it became overwhelming. So the emotional distress became too much. So the key for you is to find out 12 to 15 what triggered it, because guess what? If another similar situation happens or occurs, there is a chance that it could trigger it again. And so you work through that. And then lastly, once you're more stabilized and you got through that and you're doing a lot of things in the right direction, you got to get to that root, that childhood PTSD and the childhood trauma that you're talking about, because that's where the healing is going to happen. And remember this, the avoidance of pain produces more pain. And the same way you're going through your emotions and your feelings right now, just thinking about it.
Yes, sir.
You got to sit with someone compassionately and maybe when you're not withdrawing, in terms of, your emotion dysregulation, but that's whatever's coming outside of you is what exists inside of you right now. So
I watched a lady called Anna. I can't even think of her last name. I'm kind of in a mess right now, but she's got a site called Crappy Childhood Fairy. She's not a therapist or anything, but she helps people deal with that. So from her I learned how to write my fears and my resentments every day and meditate and pray.
Good for you, man. I really mean it. I know you don't know me, but I'm proud of you for caring enough about yourself and your life and your mental health too. Even if you don't have the resources available to you, you're trying really hard to be able to make the best with what you got, and that's better than a lot of people that I know of. So
I just want to come back to California so I can see Dr. B. But I can't,
Right on.
I thank you guys so much. So what do you think I should do? I mean, I don't know when I see him in April.
I think you should have
what?
I think you should have an open conversation with him. If he hasn't said anything, it's unlikely that he's going to cut you off. That would be pretty lame. And I would take that time and say, look, I've come down quite a bit. At the moment, I would like to stay on this. Is this going to be a problem? Obviously, I'm going to make my appointments. My urine is going to be negative, and there will be no early refills. Meanwhile, I am reaching out to mental health and therapy. I need to really address this issue. Are you going to work with me for the next, I don't know, and I can't give you a time scale. I certainly don't plan on being 10 years, but I can't give you a time scale. Are you going to work with me? Just like that, and you're gonna know where you stand, and then you can make a decision from there.
Well, see, he doesn't actually know, unless he's paid attention to the refill requests, that I'm not on fluoxetine anymore. He knows I took myself off trazodone, and he had me get off of the 2 blood pressure medicines he gave me, but the last one's the lisinopril, and they increased anxiety, and they all interfered with each other, and I'm hypersensitive to all medications just about. I can't even take opioids or whatever they call those painkillers. I can't take that. I can't drink anymore. I used to could casually drink. I mean, I've been in the restaurant food industry my entire life, and that's what initiated, actually. I was real stressed out one day. There was an employee at a restaurant, yada yada, and the little old lady gave me a piece of one of those, and it calmed me down, and I requested from my doctor, and that's how that happened. And he's gone. So this new doctor, he only gave me 15 initially, so I was really sick still, and luckily I had a few hurricane stashes to keep me through. Do you know what I'm saying? So for the past 6 months I've been stretching. Well, he gives me 35, but I go ahead and this last month I have 4.5 left over. So I felt really like a small victory there. But I didn't deliberately like, oh wow, man, I'm gonna take one of these because I want to get, like, wow. I mean, I just took my medicine because it helped my panics.
Keep us updated, okay, Goddess?
Okay. Thank you so much, and bless you. And I miss my home state. I miss Pasadena.
Oh, yeah,
Altadena. I used to take the bus all the way to the beach, Long Beach. I took the bus everywhere. I worked at Santa Anita Racetrack Mall. I worked restaurants all my life. Santa Anita's not there anymore, is it? The racetrack, is it gone? And the mall's gone?
I don't know if the mall's gone now, and I'm not sure about the racetrack. I do know the racetrack.
Okay, well, anyways, I used to run
Sure.
with all the oldies guy, all the oldie people, Van Halen, all those. Before they were famous, we used to go to backyard parties. And all we drank was all we did was drink, but I didn't drink beer. I don't like that. I can't drink anymore. I can't do anything anymore. So I looked it up and it said if you can't drink anymore, you probably more than likely are sensitive to medications as well. Do you agree with that, Doc?
I do.
Yes, sir. Okay, I know I'm taking up your
It's
precious
okay.
time.
Yeah, I'm going to
I
take
just
the next person
appreciate
on. Thank you so much for sharing. I know you helped a lot of people out. Okay. You have a great day.
Thank you so much. Bye bye.
All right. Should I get the next one on, Doc?
Sure.
Mr. Mark.
Yes, sir. How are you? Thank you.
We're good,
Hi,
man.
Mark.
Welcome.
Hi. So I'm from Israel. I know Dr. Lab Israel, so hello from Israel.
Welcome.
So my question, my situation is like this. I took clonalpine, Clonex, 0.5 on and off for a few months, like 2 pills a day, a week. Sorry, 2 pills a week. And then I had one kind of symptoms. I didn't realize what is going on. Then I read some, and I understand that I'm having withdrawal from the lower amounts. So I freaked out a little bit, and I start taking it daily. So I took daily for a month. I started with 0.5, but I decreased every week like 10, 15% until after like a month and 2 weeks, I'm at half the pill, like 25. And I'm not feeling so good. Like I went down too fast, I think. But the pill itself, I was having a bad time taking it. So this is why I reduce it. So my question is, what do I do now? Should I go up, or should I continue to taper from where I'm at now? Should I switch to another benzo?
Again, just to be clear, even though you're off the grid, not medical advice, but let me. Last time you told us, I think you were at the 0.125 a day, but I didn't know that you went from taking it a couple of times a week. You increased it to daily, and that certainly was probably the wrong move there. If
Yes,
you were
yes, yes,
yeah,
yes.
right. Because if you're having problems with a couple times a week coming off, bumping it up now, you really prolonged it.
Yeah,
So, are you taking 0.125 a day now?
yes.
And how do you feel?
Not good. And I have symptoms all day.
When did you go to 0.125 a day?
But a week. But before that, I was like 65, not 65, a little bit, 10% more. Like I went down fast.
From the 0.5?
Yes.
How small? How small can is there 0.25 tablets there?
No, I cut it.
Hmm. Yeah. How did you do at half a tablet?
What?
Oh, how did you do at half a tablet?
What do you mean? How did I cut it, or how do I feel?
Oh, how do you feel on half a tablet?
Not good. Like not good now.
Oh, how do you feel on a full tablet?
Also not good. I was having symptoms after I was taking the pill. When I took the half, when I started taking it daily. So this is why I increased it fast.
So you, but you were never higher than 0.5 milligrams a day?
No, never.
And what were your symptoms when you were on that?
When I was taking it, it was okay. It was giving me sleep. I took it for some anxiety, and I had some tremors, and it helped me sleep. But I didn't took it daily. I didn't know that I took it when I need it. But looking back, all these few months, I realized that I had symptoms. All the interdose withdrawal. I didn't know it. What was it? So then I read some in forums, and I freaked out, and I reinstalled daily. This was my mistake.
And you weren't taking anything else, and you weren't drinking alcohol during that
No,
time?
no.
So my question is, when you went to the daily, did your interdosing symptoms go away?
Yeah, sort of. After I took the pill, like a few hours after, and the day after, I felt okay. But
Hmm.
3 hours, 2 hours after the pill was bad. Like was like almost like a paradox reaction. I don't know what it was.
Well, tell us your symptoms.
Tremors, palpitation, like some strange feeling in the heart. Um, I don't know.
And are you getting these from a doctor, Mark?
Yeah.
Hmm. So one of the things you go talk to your doctor. One of the things I would actually consider in this case is, and this is Clonopin, huh?
Yes.
Okay, all right. So whatever. So what comes to my mind, and go talk to your doctor about this. Number one, let's just the equivalent dose of zero point 0.5 of Klonopin. Number one, your symptoms need to get stabilized. I would really consider doing a cross tolerance with maybe Valium, maybe Ativan, switching from the Klonopin. There's something off with the Klonopin that just doesn't work well. And I would do a cross tolerance with zero point 0.5 milligrams and check you out in a week and make an adjustment from there. And then sit on that for several weeks where you have your functioning back and you're doing normal, and then look at tapering. This is the discussion I would have with your doctor.
Okay, I will do that. And the volume and the Avitan, it's for like only one times or a few times a day.
No. So what you want to do? So assume 0.5 milligrams of Clonopin. That's our ceiling. Okay.
Okay.
Assume that dose, and then again, he might not agree, and he might not even know why I'm doing this. But so assume that's the dose, but but we want to switch from Klonopin, so you have to do what's called the cross tolerance. That means if you're going to do Valium, it has to equal zero point 0.5 milligrams of Klonopin. If you're
Yeah.
going to do Ativan, it has to equal zero point 0.5 milligrams of Klonopin. I would do a trial of cross tolerance of something else. Valium or Ativan is one of the first things that comes to mind. Let you run with that for a week, maybe 2 weeks, and see if you can get better coverage and addressing your symptoms. If that is the case and you get stability, I would ride on that for a couple of months and then consider tapering under his direction very slowly.
Okay. Okay. I appreciate.
Yeah, Mark, I have a question too. It might not even relate to your situation, but educationally, I just want to talk about. So, from the time that you started to taper down your medication and then started to feel all the symptomology, and then you rapidly went back up because you didn't like the way you were feeling, during that time frame, all of your other life situations, right? Like whether it's like relationships or school or health or work or all that kind of stuff, has any of that stuff had any type of changes that caused any additional stress through that process?
Not strongly. Like I just didn't understand what was happening. I was looking for another disease or something because I didn't know that it was from the withdrawal.
Okay.
Some
Only reason I asked that, it's called ruling it out. So what you want to
Yeah.
always do when you're looking at medication changes, you also want to rule out any type of stressors that may be happening while someone's going through the taper process, because those also can increase or decrease our anxiety significantly when we think it's the medication not doing what it's supposed to be doing and that kind of stuff. So I just wanted to kind of educate on that component, that if there are additional life stressors, it's important to deal with those when you're making medication changes.
All right. Thank you very much. Well, one last question. How can I reach you, Dr. B? I tried on the website. I couldn't make an appointment or something. Is it possible?
Mm-hmm. Yeah. Nicole's probably on here. Just so you know, I've taken a clinical leave for a short while, just for administrative reasons. I'll be back
Okay.
in about 10 days. But no, in fact, if you call the number, Nicole will set you up for a coaching Zoom call. It's pretty easy. What number were you calling?
The 1-800 or something. I don't know.
Yeah, Nicole will probably get back to you. She's around. She's on this chat,
All
and
right.
let me show you. Here she is. This is Nicole, just so you know. Okay.
Okay. All
And
right.
she's on this chat and she gets those calls. And she's really, really good at taking care of you.
All right. I'll reach out. Thank you very much.
All
Have
right,
a great
buddy.
night, guys.
But
Bye.
Mark, keep us updated either way.
All right. Thank you very much.
Bye.
Before I get Adam on, there's a question here Devin asked a while ago, and I could start the answer here, and I know you're going to have the same answer. So, Devin, he asked, how long would you recommend someone staying on a low-dose benzo to maintain anxiety and stress? And he followed that up with the amount that he's talking about. He says, what I mean by low dose is 2 to 3 milligrams of Klonopin a day. So I can tell you this, I'll let Dr. B talk there in a sec, but when he asked the question, how long, any good clinician or any good, psychiatrist or medical professional, they're going to really avoid giving you a time frame there, Devin, because everybody's anxiety and stress looks and manifests differently. Everybody's reaction to medication is differently. Everybody's support system when getting off medications is different. Everybody's trauma history is different, all that kind of stuff. So I just want to caution, not just you, Devin, but anybody from putting hey, 30 days from now, 60 days from now, 90 days from now, I'm supposed to get off X, Y, and Z because I'm supposed to be okay at that point. So when you feel like you want to get off medication, right? So that's the first thing, is like you feel like you're ready and you want to, then you open up the conversation with the medical professional to come up with a roadmap, a plan of action, a treatment plan of what that's going to look like. And also having safeguards in place that if all of a sudden you're working your way down and just life gets really unmanageable, to be able to slide back the opposite way too. So it's not always like, hey, just because you're going down, you got to commit to that whole going down process. Sometimes it's therapeutically appropriate to actually go back up to continue to kind of come down with a more comfortable pace. So and I'm not just talking about medications, obviously. I'm talking about mental health also. Like sometimes it's okay to take a pause from something deep and significantly that's causing trauma to just kind of ground again and get back into the therapy when the individual is more ready to do so. So that's what I had, Doc. I know the time frame thing. We share the same idea.
Yeah, I agree with that. I just want to add something else. Devin, just 3 milligrams of Klonopin is not low dose. If I can make it put some meat on it, it's equivalent to about 6 milligrams of Xanax. So keep that in mind. That is not a low dose benzo. And sometimes somebody needs to be on that. And when I have someone as young as you look, that really actually needs that. Look, I've had people that were chomping down 30 milligrams of Xanax a day. But in the early stages of this issue, I'm a little more aggressive with tapering down to a manageable dose, at least down to 2 milligrams, but 3 milligrams. And I always look at someone's age and their functioning and all of the issues that Parham is saying that they have. But keep in mind, when I look at someone as young as you, for whatever reason you're on 3 milligrams of Klonopin a day, my mind immediately goes to 30 years down the line, what you're going to look like. And I see those folks. Keep that in mind, kid.
Cool, man. I'm going to should I get our next person on?
Sure, Parham, you drive.
It's Adam.
Hey, Adam.
Hi, how are you guys today?
What's up, man?
Can you hear me?
Yeah. Is this the Adam from Buffalo for the passionate one about criminal justice, or no?
No.
No, okay. No worries, bro. It's good to meet you anyways. I was just
Yeah, it's good to meet you. And I just had a question. What kind of therapy do you think would be good for someone that because I got off of opiates about 5 years ago, off of heroin, and I never got the proper I did it clean cold turkey, and I never really got the proper therapy for it, and I just winged it this whole time, and I think it's pretty much messing with my mental health, obviously.
Yeah.
So that's pretty much the reason why I got on Klonopin, and then basically they pretty much just raised it. And now I'm on 4 milligrams Klonopin a day. And so and also I'm dealing with like massive amount of anxiety every time I wake up. So I just don't know if a rehab outpatient or anything would be like appropriate being 5 years sober. I don't really know if that's. My mom always tells me I should go to rehab and all that, but
Adam,
I just don't really.
what state are you in?
I'm in Washington State. Yeah.
Okay. So look, is it okay if is there anything else you want to share on that, or do you want me to kind of give you some feedback right here?
Yeah, that'd be great. Yeah, feedback.
Yeah. So first of all, man, it's congrats on being off of heroin for 5 years. I mean, that's first and foremost probably one of the biggest victories you've accomplished in your life. I want you to know that, and it's really beautiful to hear someone say, "Hey, even though I've been off of my heroin for 5 years, I feel like I didn't get into the roots, and I didn't get into the deeper reasons of why I was using a powerful painkiller to begin with, right? So heroin is a painkiller, and usually comes from either physical or emotional pain. I mean, people that are in physical or emotional pain tend to use painkillers. And I have a feeling that in some part of your past, that was a path that you went down, and you were able to get off it for whatever reasons are important to you. And now all of a sudden, a lot of that physical, emotional pain, the anxiety, a lot of that stuff is starting to resurface again. And you're 5 years sober, you're like, wait, this shouldn't be happening right now. So got on Klonopin. Your dose is going up, but your anxiety is not going away. So there are actually, the reason I asked what state are in, it's totally appropriate, man, to go to outpatient care to deal with your anxiety, like 100%. And even if it's not for substance abuse, there's good programs out there that could provide support for mental health, is what you're talking about here, for your anxiety. In those groups, man, you're going to sit with human beings that are going to talk about their anxiety, and they're not kind of dealing with the front ends of addiction. You talk about the roots of it, the sources of it, and get hooked up with a therapist. And if you don't want to go full commit to the outpatient world, finding a good therapist. And what that means is this, is it a guy? Is it a girl? Is it someone younger? Is it someone older? Is it someone that you feel you have more resistance to work with or less resistance to work with? So there's a lot of things to finding the right human being, right? It's not just, hey, I'm working with a therapist, life's going to get good. It's got to be sitting with a therapist that you can show up fully like vulnerable, like real in that moment, and start talking about things that you've been suppressing for one too many days, one too many weeks, one too many years. And finding those therapists, I mean, a good resource. I don't know what it's like in Washington Psychology today. You can go find a therapist and go read their bios, learn their information, just kind of like as if you're researching to purchase something, like research the person. And some of the modalities, man, it's different for different folks. So the most important thing for you is going to be to get into the roots of all this stuff, which goes back to when and where your anxiety started to happen. So like when your relationship with anxiety started to show up. And I have a feeling it's, prior to the heroin use, and just going there. So dude, you're on the right path, man. This is it's wonderful to hear someone saying I'm 5 years off heroin, but I need more help, because there's a lot of us, man. I'm 14 years off of drugs. And there's some days that I feel like I need mental health support, because that's what we are. We're human beings and we need help, man. So there's nothing wrong with that, man. And I hope you continue take this as motivation to go down that path, because it's going to free you from a lot of the stuff you're bottling up.
Yeah.
Adam, let me. Should I chime in? Parham, should I chime in?
Of course, yeah, go for it.
Oh, Adam, let me ask you. The anxiety. So I presume right off the bat you started Benzos, right? Once you quit the opiates, is that correct?
Yeah.
Okay.
Correct. Yeah.
And it creeped up over time, correct?
Yeah. As soon as I got sober, it basically, came back to realization of, life, because I was in a fog, obviously. So then, yeah, I got went to a therapist, and, he, told me, put me on Klonopin. I think it was 0.2 or 0.5. I think he started me off on.
And let me ask you this: to what extent does the anxiety, panic issues mitigate your functioning in life? What you want to do, what you would be doing, whether it's job, whether it's relationship, whether it's going out to the store. To what extent, or is it just an issue of, hey, I'm on too much Klonopin, I got to get this down? Are you suffering in your, let's call it activities of daily living, but technically?
Yeah, I would say so, because, I mean, like, I wake up like with debilitating anxiety, but when I take my doses of Klonopin, it doesn't it lasts, like it does something for my anxiety, but like it doesn't completely solve the anxiety issue. So like, yeah, it does in group settings and stuff like that, or when I'm like basically have to talk to like a small group or at work or something like that. That's when the anxiety triggers.
Okay.
Um,
Eh, Oh, go ahead.
yeah, just mostly like in social settings, like in
And, and when you were doing heroin, was Benzos along for the ride or not?
no, I never even like really touched. I didn't even know about benzos really too much. Like I didn't really like wasn't too much into it like that much. I was just um
So,
pretty much into opiates.
if I heard a case like this in front of me without much more knowledge, my thought would be as such. And this is going to come across controversial, and Parham might even think it's funky. But uh, 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 number one, uh, if I'm correct in my thinking, uh, you're really, really tough as nails because. For you, the opiates were masking a lot of these issues, and you got off of them. And I'm going to bite my lip here, but you ended up kind of staying in some sort of a quasi long-term post-acute withdrawals from the opiates and did just fine and have really wrestled through it. But on this side, the benzo started creeping up, and that's not what really the issue is. So this is where we're at 5 years out. If you were 8 months out, or a year out, or 7 months out, I would say, and this is the part where everyone is going to trip on, I would say, you know what? Start low dose 2 milligrams twice a day Suboxone, 1 milligram twice a day Suboxone. It's going to put your life back in order, and then we can talk about tapering off of that in the next few years. That's the way it should have gone. But I feel quite funny to tell you to take 1 milligram of Suboxone twice a day, 5 years out. So, and it really is a risk benefit thing. How long is the clonopin going to keep going on this way? So I would shelf that thought and leave it as it is. You're on the Klonopin. Number one, everything Parham said is correct, and I agree with him. But we still have to deal. That kind of thing takes time. We still have to give you some xenobiotic assistance in getting things in line. One of the things is potentially attempting some of the other stuff that we use for anxiety to attempt to facilitate how you feel through a day, how you get through the day. One of them is what's it called? What's that one? You guys all know it. My God, I'm having a brain freeze. Uh, uh, Boost bar, right? I don't know if you've ever tried that. 5 milligrams 3 times a day, bump it up to 10 3 times a day. The issue is while you're going down a road of addressing the issues that Parham's talking about, this 4 milligrams a day has to be A, slowed down because you sound like a young man. B, at the same time, on the other side of it, you have to be able to live. So I find this to be a very difficult case. And why I find it to be difficult is I think you would have benefited greatly off of low dose buprenorphine products, even a year out. And I've done that many times and prevented relapses on certain people. Uh, and I would really have a discussion with your doctor if he's cool and gets this. I just don't want to see you on 6 milligrams of Klonopin in 25 years from now.
Yeah, yeah, I appreciate the feedback and um like I feel like most of um my feelings are mostly go off of compulsivity. So like I basically feel like ever since I got off, I'm just always chasing a rush, you know what I mean? Whether that's, whatever it is, like caffeine or, because I don't drink alcohol, or anything like that anymore. So, um, actually quit cigarettes like 6 months ago too. So I feel like when I quit something, I just go all in, you know, and I don't really get like, I don't know, I just feel like I never got the proper help for when I got off of the opiates. Like I never, as far as therapy wise, you know.
So I agree with Parham completely. Whether it's an individual therapist or an outpatient program, you don't need inpatient. Outpatient is fine. I will say one thing: one, keep us updated, and number two, God forbid, if you ever get to a situation and a point 5 years out, you're like, let's say something a stressful event happens in life. We always say, Parham and I, shit happens. Life is stressful, and you're sitting here thinking, man, I'm gonna go pop an oxy or whatever it is. I only ask you that at that time, find any provider in town that will start you on buprenorphine to if that situation, God forbid, ever pops up, which it doesn't look like it, but just saying that would be your antidote to that kind of thing. Okay.
all right, I appreciate your guys' input, and
Adam, take care, buddy. Good luck, man. Come back and let us know what's going on, okay?
all right, I will. Thank you.
Parham, I got like 10 minutes.
And we got 9 minutes. Okay. There's 3 people in the queue, so let's see. There's 4 actually in the queue. Let's see what we can do. Let's 2 minutes each.
Yeah, we'll stop after George. Oh, George left. Okay.
Okay, let's see.
Oh,
Scotty,
hey, how are you?
timer today, so thanks for your patience, man. We appreciate you.
Oh, no problem. It was the 2 last guys that were taking Klonopin. I felt bad for them because I've been on it for 21, 22 years.
Yeah,
and I don't wish it upon anybody,
Yeah.
But the reason I was coming on was because last week when I talked to you and Dr. B briefly, and there was talk about the guanfacine is that what it's called? The guanfacine. I called my provider because it's off label, and I told them to refuse it, so then I wouldn't have to take it, because the office that I go to, they're demanding that I take it because they said that I need to take it to get off the Ritalin, which doesn't make sense. Well, maybe it does, but they said, we're not prescribing you any more Ritalin. You need to take the guanfacine. I said, I'm not going to take it. I talked to my PCP. He said it's not going to help you, and then that was that. So they said that they would get a hold of me, and it's been about 5 days. So they haven't called me to tell me how to wean off the Ritalin, which I don't need anyways. But the lady was asking me, who am I talking to? And I said, Dr. B. And she started flipping out. Who's Dr. B? And I said, well, you got to go on YouTube. And she was like, she thought I was crazy. And I said, you got to listen to Dr. B and Parham, because they know what they're talking about. So then they tried to put me in for a neuropsych eval, because they thought I was talking crazy. So now I have to go through a neuropsych eval. Do you think that's they're going the right route? If I already had one when I was like 13?
When you say neuropsych, are you talking about a neuropsychologist or?
Yeah, to evaluate me. Where they would do all the testing.
Yeah, those guys usually they do cognitive processing, but they also do fine motor issues. It's pretty cool stuff. It's kind of the bridge between a psychologist and I guess neurology, but they're psychologists. I'm not sure. And look, I'll be honest with you. If you came and told me you're talking to some doctor on YouTube, I would think you're crazy too.
Yeah.
I mean, it's completely fair, and I said, I'm not really giving medical advice. I was
no, I understand that.
But I would say this, remember, I also told you trying the medicine isn't gonna really hurt you. I just think my global thought with you is that if you achieve stability without misuse and abuse, why mess with someone's life? and I don't think this is all that much. In fact, in jails around here, that's what they give instead of stimulants for people that say, I got ADD. And I understand that. You have two choices, Scott. Either see if they'll talk to you and keep the Ritalin. You have three choices. Two, go ahead and you can actually add that medication right now to your Adderall, right? And it's not going to affect it, and see how that goes. Three, find a new provider. But to be fair on their end, I would say, what the hell are you talking about? And when I was younger, I would probably send you to the psych ward, but
Yeah.
but yeah,
They asked me how to spell your name, and I said it's B. I said it's Dr. B.
Yeah,
I don't know. Your last name's hard to spell out, anyways. So
yeah.
I just refer to you as Dr. B.
Yeah, that's fine. And like I said, I understand
Yeah.
what they're saying. I just, my approach would be, it's not misuse, it's not abuse, just because, God didn't say this is the wrong medication. We've
No.
overprescribed and people have gotten in trouble. This is a stable person at a low dose. Really, we consider messing with his life right now. That's how I would approach it, and I will stick by this, forever.
And all the information I'm getting is from an office manager.
Yeah, that's typical
So,
nowadays.
so they're not really. I don't think they have any degrees.
Can you
where
make Can you make an appointment and go in?
I already have appointments set up, and they said that I can't come in any earlier because they see so many people in the area.
Mm-hmm.
Because they also see people for outpatient for drug addiction and whatnot. Okay. So they're pretty much the only place in the area. So it's a large caseload for them.
Yeah, so I don't have until you go in and see what happens and keep us updated. I don't have much more on that. I don't know, Parham, if you have something.
No, man.
I think it'll be amusing once I go in, because I started quoting the Mayo Clinic about medications.
Yeah, doctors don't like that when you quote someone.
No. Okay. Well, all right. I'll keep you updated, and I'll try that.
Appreciate it, bud.
Thank you.
Bye-bye.
Bye.
Should I get George on here?
Yeah, let's get these last two. I feel bad, George and Luis.
George.
Hey guys, how you doing? Can you hear me?
Yep, we can hear you, bud. Thanks for waiting.
Oh, okay. I was wondering if it was my service or just the stream. How you guys doing? Thanks for being willing to take my questions here. So, I have a history of anxiety, no history of trauma or anything like that. I have a good life, 2 beautiful kids. I'm married, full-time job. Everything is great. I've had anxiety probably sometime in my childhood, but more so, actually the first panic attack I've ever gotten when I was 16, and I was smoking a joint with some people. That was actually my first panic attack ever. And I don't know if that's what caused the anxiety that I have, or just I had underlying anxiety. But so I take. Can you guys still hear me?
Yeah, we're listening. Yeah.
Okay, because on the stream it's cutting in and out here. So I take. I also have OCD, so I take 250 milligrams of the Zoloft a day, and I take 0.5 milligrams of Klonopin a day. But then every 3 or 4 days or so, I'll take 1 milligram total for the day, and like I make it a point not to take any more than that. So I guess when I first started taking the Klonopin, I take it on an as-needed basis, usually like once or twice a week. But then my son was in the hospital for 3 months, and that was pretty stressful. So I was like, okay, let me take it every third day or something like that. And before you know it, it was 0.5 every day. So, and I got to say, just a life-changing medication. Just, I had no ill effects from it. I didn't feel tired. I didn't feel disoriented in any way. I just took it, and I actually felt normal for the first time in a while. I guess my question is, how do I taper off of the Klonopin and get back to using it on an as-needed basis?
So Shall I, Parham?
Oh, for sure. Yeah.
I got to be kind of quick here, George. I have a meeting, but my
Sure.
first question is, how long have you been on the once a day?
About 3 years now, but I've been on it PRN for like 10 years.
So before you consider going to PRN, one of the things I want you to absolutely categorically do. So it's not a big dose. It's doing its job with the OCD and the anxiety and whatever else is going on, it seems like, and have a good conversation with your doctor. Before you even consider PRN for 2022, you take 0.5 a day and then 1 milligram every 3 days. But for 2022, I want you to make a commitment that this is my dose, this is my ceiling dose, no more increases in my life. This is what I deal, this is what I have, and this is where I'm going to stay. That's the first step in your case, because it's a stabilizing dose. Well, you've gotten here and you've gotten here. That's what it is, right? It's not a big dose. Great.
Yeah, I wouldn't say like if in a perfect world, if it didn't have any tolerance or anything else, I would take a milligram a day, but I know that's not ideal and I know that doesn't last forever. That's why I don't even like, I just want the medication to maintain its full effect for as long as I need it for, which is probably, I don't know, maybe anxiety is just genetic for me. I don't know.
No, I think
like for as long as I would need it. Like,
yeah, I think the stuff Parham, you got to gain the tools, whether it's through mental health providers like Parham and educating yourself on everything from mindfulness to meditation. This stuff does work. But what I would do right now is curb increases and really focus on when you're dealing with stuff in life, focused on this pill is not the answer. It's just at the moment helping me out. And if you want to edge towards that PRN thing, for now, every couple of weeks, start skipping that 1 milligram dose and make it a 0.5 milligram. That's a good way to start. Talk to your doctor about that approach and what you plan to do.
I actually didn't catch what you just said because you broke up a little bit, but
yeah, I said
I was going to ask my doctor.
Well, I said
I'll ask my doctor maybe if on the third day I could eliminate that second 0.5 and just take 0.5 every day.
Yeah, that's what I said. In fact, I said yeah, I said start edging towards eliminating that third day. Once you get comfortable with that, over time, no rush. Every few days, skip a dose. I want you to get it out of your idea that this is something you need. You just, it takes a while. Because I'm telling you, if you get to that plateau where you need this stuff and you think this is it, it's painful for folks, right? They're rushing to the pharmacy. So that would be my thing, in addition to doing a lot of, I don't know if you heard about, I was talking about the importance of mental health stuff.
Yeah, that's perfect, man. Thank you, George. Did that help you today?
Yes, it did. Thank you, guys.
Cool, bro. Hey, thanks for waiting. Appreciate you.
Bye. One more real quick, Luis.
Let's see.
Somebody wrote cathinone. Wow.
Device not connected here, so I think we're good here, Doc. You got to get to your thing anyways.
I do real quick. Someone wrote. Someone wrote this, and then they wrote cathinones. And I don't know why they're writing that. I have some videos on that. Parham, thank you so much. TikTok, thank you so much. YouTube, thank you so much, everybody. I'm sorry, I got a really full and busy day. I got to get going. Check out the new YouTube video that just, I think, came out this morning, and it's called Overdoses and what are overdoses or something, and what you need to know about what to do. I think it's a good video. It's a short video. It's on YouTube. Guys, don't forget to generate a discussion below about everything today. If you agree or not agree with us, that's cool. Ask us some questions. Parham, as always, couldn't do this without you. Why don't you close us out on that?
Thanks, Doc. Yeah, there was a lot of people were generating a lot of good discussions here. Thank you for your participation. Hopefully we were able to provide some education and some support for those who need it. If you missed anything, go back and watch it. Like Dr. B always says, like it, subscribe it, do all that kind of stuff. You can count on us to be here every single Monday at 11:30 a.m. Pacific Standard Time. Come back and see us and spread the word, okay? Thanks, everyone.
Thanks, guys. TikTok, same to you guys. Thanks for coming on. Again, I'll make an announcement. I have a new video on their overdoses, what they are, simplified, what to do about it. See you guys soon. We got some videos coming for you this week. Have a great day. Got to run. Okay. Hi, Parham.
I think we're still live here on this YouTube thing. I don't have the access to turn it off.